live, and we're going to hear from our sponsor. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning. I say good morning to you. What's your name and why are you calling?
Good morning, Dr. Lederman. John Monteleone. You know me from.
Well, wait a second. 1 minute, John. Just 1 minute. I just got another call. I have to take one at a time. So just 1 minute, John.
Well,
go ahead.
Yeah, I had two questions. First one was whether you're teaching your techniques to students who will carry on in what you're doing. And the second question is whether you had heard of the Gerson technique going back 30 years or so.
Well, the answer is yes. We actually give lectures around the world. We present lectures to patients, to medical groups, to places like Astro, which is the largest group of radiation oncologists. We write articles. We this year went to Holland to give lectures, China to give lectures, and also in America. So, yes, we do. About Gersten, I don't...
Do you find that are they receptive? I mean, in terms of...
Well, yeah, I think people trying to copy us, the question is, if you're in the New York area, is it better to go to the original or to go to a copycat? And, it's a slow process. We've treated 20,000 patients over many years. So the information and technology does not come instantaneously. And sometimes people think if you just buy a machine, the machine has some special knowledge. Well, a machine is just a gizmo. And just like I tell people, if you have Michelangelo's paintbrush, it doesn't mean you can paint like Michelangelo. And people think if you buy XYZ machine, I'm going to go to this hospital because I have XYZ machine. The machine's so fantastic. The machine is run by human beings, and the machine has to be programmed, and the doctors have to know the experience and the right dose and how to give the technique. And it takes years to do it properly. And we were lucky that the originator of this technique from Stockholm, Sweden, spent prolonged periods of time. I would go to Sweden and be working with him, and he would come to my office. And you just can't buy a gizmo and think it's going to go by itself. It doesn't work that way.
Okay, understood. And I hope that you have continued success. My other question was about the Gerson therapy.
I don't know that person at all.
Okay. It's something that I had caught a few number of years ago. Anyway, I enjoy your show, and thank you very much.
All right, God bless you, and stay in good health.
Thank you.
Okay, bye-bye now. Now, John, do we have you on the phone? John?
Yes.
Sorry about that.
Good morning, Doc. I'm right here. Listen, your show is fantastic, very, very informative. And I want to bring up a point that your staff is crack staff. I had a rough time with my health insurance,
right,
and they wanted me to go for exploratory radical, and they were trying to push me into it. And your staff blocked all the blocks and was able to get me into you for treatment, and I'm thankful for God for that. It's something out of heaven.
Well, John, we just spoke about your case, actually. We spoke about, I don't know if you were listening earlier on, about
yes,
the doctors. Why don't you tell people what you had and what the doctors elsewhere were offering and why you came to us?
Yes. All right, Doc. I was noticing urine in my blood, in my
blood in your urine.
Blood in my urine, and my financial situation was very poor. And I was pissing for about 3 months like this. Then all of a sudden, the doctor pushed me into treatment. I went in and got a scraping. I went in, it was 6 days, and they did a scraping on me, and it was confirmed that it was cancer.
Right.
Then they sent me out to a surgeon who wanted to remove my prostate, my bladder, and my pancreas, and my urine tube. And he says I'll be standing around with a bag on a sign, and gave me a life expectancy of 5 years. I said, no, this is too. He wanted to do exploratory radical surgery, and I said I can't accept that. And then, luckily for me, on Broadway and 38th, I wandered into your office, and
You didn't exactly wander. You had an appointment, and you came in, right?
Yes, sir. Well, I called up Iris, and Iris informed me of the things.
Just for a minute.
And she worked like a dog to help me get past the red tape of my health insurance, which really was giving me a hard time. I waited, Doc, I waited almost 2 months for treatment, and that was for cancer patients.
But you didn't wait. You didn't wait because of us, and we saw you immediately, right?
Well, your staff was A1, and they helped me and pushed along with me, and you also. And I just want to bring that point to close. You're not working with a bunch of amateurs. Dr. Lederman's staff is A1, and they're going to help you pass all roadblocks so you can get treatment and get rid of that cancer.
Now, John, you saw surgeons and others. How would you compare their approach with our approach, taking care of
Well,
the
like
patient?
I say, they wanted to do an exploratory radical surgery on me. They wanted to remove all my inner organs and leave me with a urine bag on the side of me, and that was going to be for life, with a life expectancy of 5. And your treatment is 20th century, and it gives you a life and keeps you going, and the staff is A1 too, Doc.
All right, well, we wish you all the best, and stay in touch with the listeners if you wish to provide them updates on your care.
Will do, Doc. Will do.
You're getting treated with the stereotactic frame, like I explained, non-invasive treatment, no cutting, no bleeding, and we give you an excellent prognosis.
Thank you very much, Doc. God bless you.
Okay, God bless you.
All right, Doc. Thank you.
Now, we missed a caller, so again, I'm sorry, but we're going to one caller at a time. So if you want to speak to me later on, you're welcome to call that 212-CHOICES number, which is 212-246-4237. 212-246-4237. We do have a booklet and DVD to talk to you about and to send to you at no charge. We have a special booklet about prostate cancer with our data compared to other major centers across the country. And you can see how you can get what we believe are better results, and you'll see the exact data, avoiding radical surgery, trying to keep your sex life and your urinary life all together. So again, my name is Dr. Lederman, and I'm happy to speak to you at 212-CHOICES. I appreciate you calling in, listening to us today. We have another program, 4 programs tomorrow on WOR. So God bless you and thank you. God bless you. Bye-bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week,
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work. And now they're trying to reconfigure in terms of what they can do. And he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist, first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES.